So I often get asked, how would I adapt my conversation with a man versus a woman? I'm a woman. I'm worried that this 75-year-old man is going to be uncomfortable with me bringing it up, or I'm worried that this younger woman is going to be uncomfortable with me bringing it up, or maybe an older woman. It actually has never happened to me where somebody has been uncomfortable because they're either a different they identify as a different gender, or their age is different. So the approach should stay consistent. The information we provide will be adapted according to whether they identify as male or female. Because somebody that identifies as male may have concerns about, erectile function, or may have concerns about the fact that their muscles have atrophied and they don't feel as good and strong in their body. A female may be more concerned with scars that are visible. But I also would like us to think that in this day and age, body image is a real issue for both male and female. And we don't often take time to normalize that for men. So in our conversations with men, being able to normalize that as well about how do you adapt to hair loss, or is the scarring that you're experiencing bothering you? They may look at you and be like, oh my gosh, I don't even care. Like, I lost my hair 10 years ago, I can lose it again. But even just normalizing it allows, especially for a man, to say, yeah, actually, I'm really struggling with my hair loss, or I'm struggling with the scar that's visible. So I would say, related to male, female, how they identify, that the information you might provide, but the way you approach them wouldn't be any different. The cultural read that you would need to have, so if you're working with an Asian couple, you might, if they are first generation, you might need to adapt how you approach them based on their own culture and what is appropriate or inappropriate to talk about in front of the partner. But the only way you know that is by asking. So just like I would ask a couple, oftentimes cancer can have an impact on sexual function or the way couples connect intimately. Are you having any concerns that you'd like to discuss? And is it appropriate for us to discuss that together, or would you like me to discuss it one-on-one with you? And again, the giving permission and then the checking in is the best gift we can give to our patients and their partners. And if they say it's actually not appropriate, that's great information for us. We didn't offend them. And we can find a way to give them information through written word, or send them to a website that they can learn on their own. So being culturally and even spiritually and religiously sensitive, there are certain religions that you would probably need to make sure you were checking in on, can you use dilator therapy? Would that be appropriate? I worked with a young Muslim woman who was very worried about the use of dilators because she was scared that it would affect her hymen. Now, again, many girls, by the time they get married, their hymen has probably is not intact, but for her, she was very worried about that. She was single, had not yet married, and so I had a conversation with her and her imam about would it be appropriate, and here's why we would do this. This is not sexual, this is not to have an orgasm, this is not masturbation. This is to help keep the vulva and vagina intact so that when she is going to engage in a sexual relationship with her husband, that it will be pleasurable for both of them and that she'll be able to do so comfortably.